The protocol is really easy, folks. I mean, it's like you find out where the pain is, now because the pain is going to be very near the fracture. It may be a little up or a little down from the identified fracture, but it's going to be in the same ballpark. And it's kind of like doing a surround the dragon sort of thing. You use bladder points, the Jaji points, and the governing vessel points around where the fracture is. And I always recommend, like say it's just one vertebrae, like T9, and that's on the level, is T9 on the level of GV8, I believe. But I would say, yeah, but you should do above and below. If it's at one level, like say here, here we go. GV7 is online with bladder 19. Then do GV7, GV8, GV6, bladder 18, 19, and 20, and then the Jaji points in between there. Just kind of surround the compression fracture. Now, of course, you can use some points like governing vessel 4 and bladder 23 just to build the kidney system. You can use other body points for building the kidney system. But the main treatment is where the problem is. And of course, you need to be careful with needling near the ribs to avoid pneumothorax, especially in a in a thinner patient. It's helpful to use heat therapy during the treatment. My favorite type, of course, is TDP lamp, but you could be using Moxa, obviously. And after the needles are removed, it's really good to do a little light acupressure massage. Don't be digging in there too deep. Nice, just gentle massage. Especially you can work in some herbal liniment. If you have a kind of liniment that you like to use in your practice, this is a great place to use it. And you can also use herbal plasters. Now, this isn't technically an herbal plaster. It's just what my graphic arts guy found as a replacement for an herbal plaster. But herbal plasters can work really great for compression fractures. If you have herbal plasters that you like to use for pain management, you can, definitely use those. The only thing is you have to be careful, and this is true even if you're the patients aren't going to be able to reach the compression fracture probably themselves to rub in the liniment themselves, but if they have a caregiver or a family member that could rub the herbal liniment in, that's great. They could go home with that. Or you could use the plasters. But if it's a patient, an elderly patient that has some, cognitive loss, if they're not, if they have some dementia or some degree of cognitive loss, you just can't risk them, doing this themselves. So you have to be careful. If somebody can do it for them, that's okay. I would still, even there, I would be very careful about the plasters because they can irritate some people's skin, especially older patient that tends to have more sensitive skin. So you might need to test about whether they can handle plasters or not. And then again, mild heat is also good that they can use at home. And I wanted to go over a little bit about the positioning because it's definitely better to have the patient face down. So we use, this is a body cushion that we use. Our patients love this. But for some older patients, it's hard for them to get into the prone position even in a body cushion. So you could use, if you have a massage chair, that's great. Or you could make yourself a little homemade massage chair kind of setup, which is just having a patient sit on the, towards the end of a chair, and then with some pillows that you can stack up to give them support so they can kind of lean forward on the pillow. Of course, they would have their top off, and you could be doing that treatment in these areas in that type of position. Now, for the treatment frequency, It's best to start with 2 to 3 treatments a week, especially because these people are going to be in more acute pain. And then, so this is the basic treatment goal I have for so many different conditions. 2, or even in this case, 3 treatments a week, reducing to once weekly once the patient has maintained progress for a couple weeks. So if you're doing twice a week, 3 times a week, and they're feeling better and they come in, they've been better for a couple weeks, you can go down to once a week and test to see if they're still doing better at that frequency. If so, then you can do a couple more weeks at once a week, and then you can stretch out the last 1 or 2 treatments at 2 to 3 weeks. And if they're holding that progress, then again, you can release them from care with instructions on how to use mild heat and or something like herbal liniment for home treatment. Now, if there's no improvement after 5 or 6 treatments, you should alter the point or try something different in your adjunctive therapies, because this is one of those that you should see improvement within the first, within the first 5 or 6 treatments, if not within the first 2 to 3 treatments.